evening, Borno. Welcome to Borno Health Update, your frontline lens into Governor Babagana Umar Zulum's revolutionary healthcare transformation. I'm your host, Ibrahim Amara, and tonight we are diving into life-saving mission, how cutting-edge emergency medical services are fueled by delays, poverty, and insecurity. But now a beacon of hope emerges. The emergency medical ambulance services system. This isn't just about vehicles and sirens. It is lifeline, bridging gaps in care, rebuilding trust, and racing against time to save lives. Behind every breakthrough, there's a blueprint stage.
Witnessing one of the milestones in the health sector reform value chain in Borno State. It is so important because many of us have struggled, will be solidly on the ground for our people to benefit from these developments. His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, MNI FNC, is very passionate about the healthcare sector the first 48 hours, emergency treatment for emergency cases for under 5 years children in hospitals and health facilities. And one of the most striking one is the emergency care for people with gunshot wounds. And definitely this is one of the reasons why we should even be more, we should all hands should go on deck to ensure the takeoff of this project. Daily we have gunshot cases. Daily people die of gunshot wounds and complications. So we must all work to ensure that this value chain is fully implemented by everywhere across the state. And this intervention will definitely address the shortage of antivenom, emergency snake care and all these things. So I Ministry of Health are committed to ensuring the takeoff of the EMS and ambulance system in the state. The chairman of the secretary committee has already pointed out that an office has already been given to this system, and then staff has been deployed, staff consisting of ICT staff and other, because it involves a lot of ICT. So there is close communication with NCC. NCC have already provided all the materials and gadgets required for the takeoff of this project. So we are fully steered to take off. The full takeoff, we know there are challenges, but all these challenges are surmountable. With the support of all the stakeholders and partners. And I will once again also thank the Yobe State Emergency Service and ambulance systems for their technical input, what they are doing. We thank them sincerely, and we urge them to always be their brothers keepers and continue to give their support until it is we reach the promised land. So having said that, singular honor and privilege on behalf of the Honorable Commissioner of Health and Human Services, Professor Baba Malungana, FWSCS, FCIS, FRCS Glasgow, to declare this workshop open and wish ourselves fruitful demonstration. Thank you very much.
In his remarks, the chairman of the Emergency Medical Treatment and Ambulance System Committee, Dr. Ibrahim Kida, outlined the steps the committee has taken since its inauguration.
All the teaching hospitals, the federal psychiatry, the maximum 70 hospital, and then we immediately followed by going to Yobe to try and copy what, well, at least learn what they are doing, so that we can immediately come back to Maiduguri and start. I am actually emergency medical team technical committee members. When are we starting? When are we doing this? When are Two, the office complex is along the Borno Investment House, which again is very close, together with the signboard is already on display. We do hope that things will improve, so that we need to really start swinging into action, because we cannot be, the last time we were in Europe was sometimes in January, and now we are almost in end of May, and we really need to make some progress, so that people, the zeal with which we started, we have to continue with it. And the aim obviously is accepted very well, obviously to reduce maternal mortality, to reduce morbidity, and so on, which obviously is almost the only, what is actually reigning in the country.
We really had wanted to have started this session earlier than now, but we were made to understand that one of your principal officers was bereaved, and that led to the delay. And we understand the circumstances. But then I just want to plead with the office of the Honorable Commissioner, sir, that this training may likely be extended because of what we did, even during the national. It took them from 8:39 to almost 5 p.m. before we come up with this very valid document. And for us also to start something in Borno State and come up with a document of this magnitude, honestly, we need to be high to start this session.
In February this year, the Borno State Emergency Medical Treatment and Ambulance Service Committee, BOSEMSAS, has commenced its activities with the learning tour to Yobe State, which is said to be one of the best states so far in the management of Yobe State Emergency Medical Ambulance Service Agency, Yemabos, in Damaturu, the capital of Yobe State. BOSEMSA Chairman Dr. Ibrahim Kida explained to the management of Yemabos the purpose of their visit, while Director of Operation Yobe Emergency Medical Ambulance, Dr.
We came here, we actually quite surprised that it's a very big project with all the directors. Initially, we were thinking we just talked of finance unit, audit unit, and so on. We didn't know that it's quite an established project with all the requirements that's involved. So we felt that let us first come. Now, as we are coming, we are seeing things. But when we hear it from your mouth, how is established? What are the functions of the committee? What are the functions? And then we will also now learn everything, and when we go back, we'll also need to show our honorable commissioner. Initially, he was to come, but unfortunately, because of his duty of his office, because initially we were to come together, then finally he said, no, I think we should just come on his behalf. When we go back, we are going to report to him. All the things we've seen. We also have a video, so we'll definitely go and show it.
Funded for the emergency medical treatment, which is supposed to be the 5% of the basic healthcare provision fund. Now, in 2016, the policy for the emergency medical services in Nigeria was established. And this is actually, its main objective is to ensure that those in need of urgent medical care are treated. And also, from that point of care, point of incident to the point of definitive care. And the overall thing is about integrating the pre-hospital and the hospital services, which before now, they are separate entities. Care of a patient starts from the hospital. Once the patient comes to the facility, that's where the care starts from. Now,